in order to basically protect ourselves and to make sure that we have everything going on, technically the National Fire Protection Association Safety Code says everything that you're using as a modality on a patient, whether it's ice, whether it's water, whether it's just your general machines, they have to be safety checked every 6 months. So this includes all of your, and it doesn't mean they have to be calibrated, it means they have to be safety checked. That means an electrician has to come in, look at the machine and say, hey, there's no frayed wires, it actually turns on, it actually works. There's your 6-month check. That's really what they're looking for in terms of a safety check on those machines. The calibration has to occur yearly, the safety check should occur every 6 months for everything. Okay? Does that make sense?
And you only need a report every 12 months.
I need a report every 12 months, but it should have the 6-month check on it. Okay? So you're going to have to keep your own records for the 6 months. I need a report every 12 months. Okay? All right. So we're still keeping that August 1st. You can turn it in any point in time from the end of the school year until August 1st. I mean, you can turn it in to me tomorrow or this afternoon. Don't care. Okay? As long as I have that before August 1st, we're good to go. All right? More questions on this one? I have not found a different code to go with that does not require us to do safety checks every 6 months. Okay? It'd be nice if we were able to do that, but I haven't found a different one. This is the one we're going with, and this is what we have to go with. So that's kind of where we're at. So moving on to our practicum evolution. As most of you know, we no longer have these skill checkoffs that we have to do. So it doesn't have to say demonstrate the student knows how to tape an ankle. We don't have to do that anymore and show those at our clinical rotations. However, what we are doing now is going to these clinical integration proficiencies. All right? So there are 9 of them total. Some of them have some subsets, but it is a global and comprehensive skill evaluation for what they should be demonstrating while they are at their clinical sites. Okay? The way that I would like this to work is that I want these checks to coincide with their evaluations that they do. They do one at mid-semester, they do one at the end of the semester. Okay? So this mid-semester CIP assessment, look at the list, figure out where they are. If you haven't seen some of these skills, make sure you note that, and we can go from there. The whole idea behind the mid-semester CIP assessment is to drive what their focus should be for the rest of the semester. Okay? So if they have to do environmental concerns and emergency procedures, looking at the EAP, different things of that nature, lightning safety, all of that type of stuff, if you have not seen them do that at the beginning of the semester, the first half of the semester, it might be something you want to incorporate into the second half of the semester. The assignments they are doing for their practicums should allow for a lot of these things that they should be tested on for their CIP to be shown to you. They're going to have to do assignments where they're going to have to critique the EAP. They're going to have to do assignments where they have to hold stabilization, C-spine stabilization for an unconscious athlete. Things of that nature. You're going to be able to see what they're able to do in those terms, hopefully before the midpoint of the semester for a lot of these. Okay, the more advanced the student is in the program, the more of these CIPs that you're going to end up seeing. Do we all know how to get to the CIPs? A-track, scores, type in the name, type in the course number. Okay, all of them come up. You are going to be able to see the scores from the previous semester. Okay, anytime anybody's ever rated them on those scores, you're going to be able to see the score, you're going to be able to see the comments. Okay, that's going to be something that you're going to be able to base your commentary on, you base your score on if you need to. Okay. However, if you have not seen the skill, just write not applicable, or there's an option to say did not assess or did not see, whatever. I don't remember what it is for this one. That one. But that's really what we're trying to do for this. So if you want to take note of times during the semester where you saw some of these things, just so you can refer back to it and give specific examples, you can keep that in there. It just doesn't need to be a score for that point in time. A-track will save your comments in there whenever you need them. So you can go back in and alter that and then finally give a date for the mid-semester and say there was these 3 instances, they performed great on this one, not so hot on these 2. Whatever it might be, that's kind of what we're looking for, okay? The other piece of this is for scores of 1, 2, or 5. So we want most of our students to be at a 3, which is the minimally accepted proficiency score for our students. That means they have the skill, they're not really good at it, but they have the knowledge, okay? The 4 means they're proficient, the 5 means they exceed expectations or they are completely autonomous in that skill. You do have to keep their grade level in mind. However, if I'm seeing scores of 5 for some of our sophomores on some of these CIPs, I'm really going to question, okay? For a score of a 5, for a score of a 1 or a 2, I really need commentary in terms of why you gave them this score. There has to be some sort of justification for why you gave them an autonomous score versus a proficient score. Does that make sense? We should be commenting on all of it, but in order for me to actually think that this score is actually something that I'm going to, honestly, that I'm going to believe, I really need a commentary in terms of how they're doing, okay? Whether it's they're doing fantastic and they're completely autonomous, they're better at this thing than I am, or whether it's, 1 or 2, they have absolutely no idea what they're doing. I still need examples, I still need ideas of how we can either remediate or how we can bring whatever the student is doing so well to the rest of them. It's only going to help our program if we can move on that way. Okay? So keep level student in mind. Went past my screen. So this is an example of what the 8-track thing is going to look like. For these different skills, it doesn't have to be like an overwhelming amount of comments. Give me specific examples. Had multiple situations that required use of CPR AED skills, her spine boarding skills, and the use of vacuum splits. She's performed exemplary, completing everything to the level that requires no prompting and suggestions for her preceptors on these given skills. That is enough of a justification for me for a 5. Okay? 2, needs significant improvement on communication skills, very soft-spoken and gets flustered and refuses to use relevant terminology and language when given the opportunity to speak to coaching staff or school administrators. The single time she was asked to communicate with team physicians, she was unprepared for the conversation, even knowing days ahead of time that she would be presenting. Right? Again, enough of a justification so I know what's going on. Right? It doesn't have to be anything more than that. Right? And please don't copy and paste this and just put it in there. Make it relevant to the students. But okay. So we're going to go through this a little bit and see if we can get these scores to where we're going to be comfortable with in terms of what we're doing. Okay? So I'm going to give you a scenario. We're going to talk about what we would possibly rate the student as for our CIP scoring. Okay? So our student profile, we have Charlie Conway, a junior student from fall semester in 2018. So this is next fall. Does everybody know who Charlie Conway is? Please tell me you know who Charlie Conway is.
Joshua Jackson.
Y'all need to watch your Mighty Ducks. It just makes me sad. I used this example in class and got the exact same reaction. One person was like, oh yeah, Mighty Ducks. Nope, nothing. Okay. Anyway, so this junior student is doing a fall semester football rotation. Okay, he's had responding to emergencies, he's had prevention and care, which is basically everything that you can learn from Prentice. Okay, ATR 1760, which is the taping and bracing course, lower extremity evaluation, and kinesiology, so they should know all of their anatomy. I can tell you right now they do not know all of their anatomy. But that's where we're at, okay? So the student history. So the first half of the semester, we're trying to give him a mid-semester score on our CIPs. So he's able to complete an inversion sprain. That is not correct. You can fix that sentence in your head. That doesn't make a lot of sense. With proficiency, it struggles on more complex injuries, okay? Knee evaluations are able to be completed, but needs a lot of prompting and additional resources. He hasn't had any hip or low back injuries he's had to do. And then upper extremity injuries, he's able to complete with a lot of prompting. This is the skills that he's just learning this semester, okay? So we wouldn't really expect these skills to be exemplary and over the top. This is just something he just had exposure to and just finished doing for his rotation, or for his didactic learning. So, CIP number 4 is the one that deals with upper extremity, lower extremity assessment. So all of the clinical reasoning they could possibly need, all of the assessment procedures, they perform everything. They have patient-oriented and clinician-oriented outcome measures. They can choose and select initial care and overall treatment goals, okay? These are things that they're able to do at this level. They're probably not able to recommend or prescribe rehabilitation techniques yet because they haven't had that course yet, but they can do the first half of it. They can do the evaluation and give those initial treatment goals, okay? So for this CIP of 4, we have lower extremity and we have spine. So what do we all think we're going to rate the lower extremity? Based on this information. What are we thinking?
3.
Probably 3, right? They have the knowledge, they're able to perform it, it takes a lot of prompting, they are not yet proficient at it is the main term, okay? So proficient, they're able to do it with minimal prompting is really what we're looking for. So for the lower extremity, we're probably going to rate them a 3. What about for the spine? NA, or not able to perform, right? We have absolutely no idea how they're going to do because they haven't had to do one, all right? So very, very simple for that one, okay? Just warming up for number 2. Clinical example number 2, Julie Gaffney, senior student, spring semester 2018. She has that high school rotation, all right? You can use your own high schools as your basis. There's some of you have more sports than others, different sports than others, whatever it might be. She's at a high school for spring semester 2018, okay? She's had emergency medical response, which means she's able to do all of the airway adjuncts. She's able to administer supplemental oxygen. She's able to do peak flow meters in terms of trying to rate any type of breathing situations, all of those things that she's had. So she's had that upper level emergency response course, okay? Prevention and care in 1760, she has all that information. She also has lower extremity evaluation, upper extremity evaluation, therapeutic modalities. Therapeutic exercise is the course that she's in right now, okay? That's kind of where we're at, okay? So student history, identify signs and symptoms related to asthma and breathing conditions, and helps an athlete administer an albuterol inhaler. Able to do that. Struggles with instructing and interpreting data from peak flow meter. Okay, this is something she had last semester that she's just now basically implementing, probably for the first time. Okay, but in a real situation. But peak flow meter, it's information she already has. Struggles interpreting information and making recommendations based on blood sugar levels for your diabetic athletes. Administration of epinephrine autoinjector was proficient during scenario created for practicum class. So she had to do an assignment where she had an athlete who ended up needing, who was in an anaphylactic situation and ended up needing epinephrine. She was able to do that without any problems whatsoever. Okay, and on this assessment, she was rated a 3 at mid-semester, but she has shown some improvement, though she still struggles. Okay, so mid-semester she was rated a 3. So this CIP is develop and implement and monitor prevention strategies for at-risk individuals and large groups to allow safe physical activity in a variety of conditions, obtaining and interpreting data related to hazardous environmental conditions, monitoring body functions, and making appropriate recommendations for individual safety and activity status. Based on that scenario and based on what you've seen from Julie, what do we think we're going to rate her for the end of the semester? We can't do 0.5. Has to be whole numbers. Has to be whole numbers. Probably 3, right? She's probably still at a 3. Although she's shown improvement, she's still not proficient at this skill. Unfortunately, we can't rate her a 3.5 because she's shown improvement. It's great that she's shown improvement, and that should be something that's written in the comments that she's shown improvement, but we still can't rate her a 4 yet. Okay? So, and I know we run into these situations a lot where they're kind of in between levels. I want you to go with the lower level because you can make a comment in there. So maybe they will continue to work on it and get to that proficient level. Okay? Do we have questions on CIP scoring? All right. Yeah.
Change my mind. So I know for mid-semester evaluation, it's okay if we put NA if we haven't
Yes.
seen something yet, but end of the semester semester, we should have been looking at that.
Right, so the end of the semester, based on the fact that you had to do a mid-semester score, and I'm kind of building this in so that we remind ourselves to look at it too, I would like there to be a score for everything at the end of the semester. If it's something that you really had absolutely no exposure to whatsoever, then you can put an NA. But try as hard as you can to put them in a situation, even if it's a contrived situation, where they're going to have to use those skills so you can see where they are at. The clinical assignments that they're getting, the things that they have to do for their clinical rotation while they're in your presence are really designed to show you these skills, but I can't show you everything, okay? So if you need a situation and you want a little bit more information and have absolutely no idea, contrive a scenario where they have to do something related to that CIP. Yes.
So then it's specific to the CIP, not the just broad 1, 2, or 3 for the evaluation.
Yeah, just
Okay.
specific to the CIP. The ones at the very end of the professional behaviors is really just to give us an idea of where we might need to increase our content.
Okay.
Those are not scored whatsoever, they do not count against the student whatsoever. It is just to give us a better idea of what's happening. And I'm toying with the idea of getting rid of that. I will let you know if that happens. There's a lot of hoops I gotta jump through in order to try and make that happen. We're asking you to score a lot of things at the same time. And so the professional behaviors is what gets scored and the CIPs are what gets scored. The 1, 2, and 3, the bottom of the evaluation, does not get scored whatsoever. It's just information for us. That's all it is. So, moving on a little bit. So kind of going along with that. So our professional behavior scoring. I am no longer going to allow you to give people a perfect 100 without extreme justification, right? I love our students. Not all of them are 100% on their behaviors in terms of professional behaviors, okay? There are some that are very close, and there are some that I can see the justification for 100, but no longer will you be able to give a blank 100 without an extreme amount of justification on the professional behavior scoring, okay? So what are some common issues you are all seeing with professional behaviors right now in terms of scoring them? Lack of options, can't give anybody a half score. We're asking our students to be at a 3, 4, or 5, right?
Yeah.
It's where we want the minimum of all 3s. That puts them at the minimum acceptable of what they need to do, okay? So, here's what we're doing right now. So for every 5 they get, that's 100% on that given skill, or that given attribute. 4 is at 85%, 3 is at 70%, 2 is 55, 1 is 40, okay? This is what you have right now. You have effective, somewhat effective, very effective, all of those different things, okay? Way too many times this year I was seeing scores of everybody gets a 5 for everything, and I don't want to see that anymore, okay? So this is what we have currently. My question to you, and what the information I'm really trying to get out of this, is do we need to go to a different scoring system that gives you more options?
What is your grade scale? Does that turn into a grade?
Yeah, so this ends up turning into a grade. So for all of the attributes they display, it gives them an average percentage at the very end. So if you look down, let's say you give them all 5s, that gives them a score of 100%. Okay? All 3s will give them a score of 70%. All 4s will give them a score of 85%.
And an 85 on your grade scale would be what?
A B. So it's ABC for 1, 2, 3. ABC, D, F. Okay. Actually, ABC, F, and F. But F and really bad F. But that's kind of where we're at. So we only have these 5 right now. I have 2 different slides right now that's going to show you 2 possible alternatives for the grading scale. I want to know if this is something that we want to go with for next year. Okay? It gives you a little bit more of a leeway for a lot of these different things. Okay? So this is our current scoring system. The first option we have is going with half scores. Okay? So they can get a score of a 4.5 out of 5. They can get a score of a 3.5 out of 5. If they're somewhere between the numbers and you just have to give them a number, this gives you more options, right? So this is one of our options. 3 is still going to be the main option for this, or where we want our students to be, a minimum of a 3. However, we have a lot of options ahead of that that's going to hopefully eliminate the idea of that everybody gets 5s. Okay? So this is one option. So it's still 5 is very effective, 4 is effective, 3 is somewhat effective, and then 1 is going to end up being the ineffective piece of it. Okay? That's one option. The other option is that we go to a score out of 10. Okay? So the 10 is going to be 100%, 90, 80, 70, 60, 50%. Okay? So that is our other option. The ones that's, this one here where we're giving the half scores, nothing changes in terms of grading. So it's going to end up being, this is 100%, a 4 is going to be 85, and 3 is 70. Okay? The other two are halfway in between those ones. Is with the score that they'd end up getting for those. Okay? So those are our two options for potentially redoing and reworking this scoring system. We also have the option of leaving it exactly how it is, and you just know you can't give people 100% anymore. That's another option that we have. So I'm looking for feedback from all of you on terms of what we want to do and what's going to help you give me an accurate score for these students.
Maybe the 1 through 10, just because then we know percentage-wise, like, yeah, they're at a 90, they just need a little bit of improvement. Or, yeah, no, they're more 80, or yeah, they do really need a 70% in that because they're just, you know, at that minimum 3 level or whatever. Just because then percentage-wise it would make more sense to us, like we can equate that easier than like these half points and stuff like that. Yeah.
Others?
I actually like this one better. I think it gives less options, and I think for having students consistently score below a 3 and a 4, they shouldn't be in the program anyway.
Okay.
So this way you're scoring a 2, 1.5, and 1. I think it's a little more clarity on how poorly they're doing.
Okay.
So that's just my
I also like this way better because it kind of creates that option to give them that little bit of extra if we feel like they've filled in that gap. But then I also feel like if we're using the 10-point scale, a lot of times you're just going to think, well, I don't want to give them below, you might not see scores below 7s ever.
Right.
Because I feel like people.
70 is where they have to be.
Yeah.
Yeah. Okay. Anybody else? All right. Does anybody want to make a case for leaving it the way it is?
I don't want to leave it the way it is because what was just said, a 4 or a 5, they may not be a 5, but they're definitely better than a 4. Personally, I would like the half.
Okay. All right, so why don't we do this? What I'm going to do is, actually, why don't we just do it right now? Let's just vote right now. Okay? So we're going to do number out of 10, and then half numbers. Okay, so these are two options. So we're throwing out the idea of it leaving it the way it is, right? So it's no longer an option for us to vote for, okay? So take a minute or two, think about it, whatever you want to do for this, and then we'll go into the number out of 10 or the half scores, and you can figure out which one you want. Yes?
Quick question. So for like the 1 through 10 one,
Yep.
what would be like a minimum for where you want them at? Like a
70.
Like,
Yeah, 70 is our minimum accepted for what we have for the program, so that's what we have to keep it at.
Okay.
Okay? You can talk amongst yourselves, discuss it if you want to.
Probably scoring.
I haven't had that film yet, so.
I just think they're giving them the ability.
So we're either adding half numbers
They might get it right.
But the ones like being punctual, you're just there on time.
Yeah, but I mean, but just,
But like other things.
yeah, but is that the only one? I mean, truly from a professional.
Right.
Somebody trains for
Just me.
Nice.
Keeps me busy, that's for sure.
Yeah, that's for sure. My first year is out, and I was the only trainer in a
We're not too big, but it's just a lot when we have a lot of things going on.
Sure.
The winter's pretty relaxed because we just have swimming, wrestling, and basketball. So we're just guys.
Yeah. So that's not bad. So that kind of puts your athletic population. Yeah, I would do that in three seasons and then go right into independent professional baseball.
Yeah.
And then like 3 days off.
It's nice because the fall's pretty crazy. It's like I get that like winter where, I mean, I'm still pretty busy, but it's not. And then the spring is just crazy.
No, and I get that.
So what? How many? Let's say Parks.
I want to say we're at like 50 maybe. Yeah, we've gone down a lot.
Any particular reason why?
Like, there's been talk that they were trying to put the freshmen and sophomores together, so just be sophomores and freshmen.
Sure.
Because that's what a lot of people are accounting for. Because they're not getting the numbers from the freshmen, so you might as well just combine them.
Just to decrease the student body.
That just, and there's not as much like, yeah.
Everyone, I don't want to break up this great collaboration. I'm sending around the Preceptor Training Development Sheet. Please sign in, make sure you put your email address on there and any current cell phone numbers. As well as the last thing I forgot to mention, if you did drop off your modalities, stay afterward. I have them in there, including the worksheet that Mark Peters filled out. So just wanted to make those 2 announcements, and there's still plenty of food out there. So make sure you, I'm going to pass this around, make sure you get to this, okay? Thank you. And I'll start that right here.
So that is another thing to add on, we can talk about.
Does ATI at the clinic, they have somebody come in and do all the modalities? Like, to get it.
Well, and so it's,
Once a year.
it's number at 5. Have so many options. So now adding in the half numbers gives you more options above. So the half numbers gives you more options above the expectations that we're
I mean, we have all the counts. Since I've gotten there, we've never used it because and they're like, oh yeah, you can get a calibrator. I was like, sweet. So I get it all set up. There's no power. And I have to call whatever company and see if they have like power meters. But I didn't know if like if I brought that into the getting theirs, they would.
Okay, ready?
Well, I haven't.
I should have done a poll everywhere so nobody else is doing that. We're not that advanced, so. Alright, for those of you who want this
I mean, I live right next to the
focus, bring it back in, focus up here. Here we go. Alright, number out of 10, raise your hands.
Yes.
You change your mind?
I'll strongly vote that.
Alright, we got 1. Anybody else want to jump on there with Heather?
I think it's fair. Teamwork makes the dream work.
Alright, so 2. So it looks like we're going with the half numbers, huh? Raise your hands with the half numbers. You gotta vote. Everybody's gotta vote. Okay, yeah. So, all right, we're going to the half numbers. All right. So, I will be working on this over the summer to redevelop this for the half numbers. Okay. We are still expecting a 3 to be at about 70% in terms of what we're looking for proficiency. They meet expectations. They are somewhat effective. They are not extremely effective. Okay. Minimum acceptable is going to be still going to be a 3. It does give you more options above a 3. So you can say, well, they're doing a little bit better, but they're still not quite there. You have all of those options to score. Hopefully this eliminates people getting 100 out of 100 without an extreme justification for it. All right? Okay. So we are going to take a break now. Go to the restroom, get more food, get more coffee, whatever you might need to do. When you get back, I'm going to give you more information about our master's program. Okay? So that's what's going to come after the break. So do what you need to do about a 10-minute break.
Job. hang that up for everybody to see in the training room?
I think everybody deserves a fair shot. That's what it was. I'm pretty cushy thing over here.
But because it just drops from 11, we don't need all your hours. So anything below that is.
That's fine, they're at.
John's the end of the year. Don't need this.
He's gonna have that. That's kind of where we're at. So he has to do 50. That's really all I'm worried about.
Impulsive. Should block that. Oh, so he's like me and my buddies. I'm gonna go to class. Oh, Friday. We'll come back Friday. You gotta make sure you got the money. And then if he's there, deal's still there. The one big the certain ones?
I'll extend it.
Just keep them there for Halloween.
I'm going.
We can all dress up as Waldo. Because there's a Waldo, there's a female Waldo.
So there's a couple people in here who haven't done preceptor training yet. So this is their initial preceptor training. So it's ongoing. If you kind of sit and listen to me talk.
Yeah, they tried to do it with the but we couldn't even get a softball.
No, for the next So you walk in because we're thinking.
Oh, that's like, yeah.
Like this, like a longer entryway. Here's the taping station.
Yeah, kind of barriers with stuff. Yeah, depends on the,
That's
you know, with everything,
Yeah,
so
so it's just.
This big cabinet.
for the most part, we have a pretty decent amount of people.
Oh, I'm good, thanks.
Like, you know, like, most of us have, so it's nice.
Did you guys see a decline in the
Really,
I don't think
There's signs
you yawn as much as you want to. Ignore me as much as you want to. Like, I really don't care.
Our ID was just talking about that too.
Signs up on the walls, like, yeah, these are like, here's like some English, and I see that's the season and all that stuff.
Well, it's coconut milk, so it doesn't have flavor. So it's not like coconut flavor, it's just coconut milk.
And we're like, we're gonna see another place,
I've gotten into doing the refreshers with, it's incredible. It's like an amped up strawberry pepper. It's fantastic.
So you do the strawberry acai you want?
Yeah.
You do the berry juice.
The strawberry acai. Yeah. It's the water.
I really enjoy this.
I have a friend, she doesn't drink coffee, but that's like her vice.
Yeah.
Is that she's the one who got me hooked on it. So that's her thing. She's just like she's like Starbucks. So much money at Starbucks because actually it's for different refreshers.
I wasn't until the refreshers.
Coffee, iced tea, like I feel black. It's good, but I'm like,
Yeah. I switch back and forth between Starbucks and Dunkin'. It depends on what kind of mood I'm in and how much caffeine I actually need. Because I think Starbucks coffee is stronger.
Yeah.
So I've been doing nothing but making Starbucks coffee for like the last 2 weeks. Yeah. It's pretty close. We're almost there. It's just like the last thing I can do, so.
I know, I always forget
It's always like 10. A
Yeah.
little bit.
Yeah.
I'm still switching around a lot of stuff for next year, so I have to work on that.
Stuff like that.
We have a student who's doing a course substitution right now, so I have to
At least I know cross country, you should We don't post any assessment units.
Neither did we did my first year, but it was always like
during the school year, like creating all of those trends all in one.
Well, they're not that, but I've been.
Well, and I was gonna say, and you have to have it in the middle of.
Yeah, it's like, I love.
Yeah, so
And you're like, hey, we have a meeting segment, let's do it.
master's proposal.
I'm sure it'll be better.
Percentage's different, I feel like.
You know, it's only stuff like here.
Yeah, right. Or decreasing the number of students, increasing the number of other students I have to deal with, so. Yeah, so teaching sports psychology in the spring, and it's not just athletic training students, it's every grade. So, yeah,
That's all
so I gotta get back in.
Well,
I like that class. And then we're actually doing a proposal for an international trip. So we're doing a global sports psychology class. And then, so we're talking about, how sports psychology works in different countries, and then concepts that we're planning on a trip to Ireland.
usually it's
For a week.
already upset at the beginning.
And just to do that, so.
What is that?
And we are allowing other people to audit the course if you'd like to. I don't know what the cost is, but you can come at the end of May. Yeah.
Maybe it's next year. All of our playoff stuff. Thanks, Abe.
About the
Actually, on time, I'm not just
We post it, we don't, another one of those, post it, we don't. So post it, but it's at Memorial Stadium. And it's a 90% chance.
Well, and it's not like you need a ton of stuff like that. I know a lot of it's like,
Yeah.
100% of your students, but.
Like all the skin conditions.
I never know students are sending treatment, so I'm gonna send out a survey if
We
you
had
want specific things during
state
presentation,
title.
you need to let me know, so.
There's a lot like that.
Maybe I'll get a nurse down there, so you're 13 this
A
year.
while back, they used to do like, you get 1 hour of CT for it, which I thought was nice. Come in and have that, and I know that the DOC is a paper hard.
They don't let us do it anymore, because training is not
They
counted.
are.
Really?
Yeah.
Like,
Unless
they're
you're
not
going
like
through it.
I mean, like.
Even for the,
'cause I feel
like the
good,
master
but-
preceptor, or like, module they have coming out, you still can't get students for it.
Like, really?
Yeah,
Yeah, it's something
they've taken away that option completely,
Yeah.
so preceptor training is no longer
very
able to
interesting to
get
see
students
like
for.
our college too sometimes.
And
I've been really
So
good
from, do they require a certain amount of equipment that you
they
spend
watch
for
us
preceptor training?
before.
It's just you have to do ongoing training. So I could have recorded all my voiceover on all of this and sent it out to you and made you do a survey that says, hey, we're, make sure you watch this PowerPoint, and as long as you agree that you went through preceptor training, I don't actually have to have any of you come in here anymore.
Yeah.
So some of the schools, especially the ones that have sites that are extended, that's what they do. That's how they do their preceptor training, is they have basically a PowerPoint voiceover or a module voiceover that they make them do, and it goes from there. So it's like all of like the HIPAA and FERPA training and the sexual harassment training and all that stuff that you had to go through for school, very similar to that. That completes your training for that course, or for that school. So, I don't know if we'll ever get there. I don't bring this in. We feed you. It's food, it's just food.
Those are like $100 to replace. They're really expensive.
Can't complain.
Oh my gosh.
Yeah. They're eating and
Yeah.
So.
we walked by, we were like,
Okay. But, let's see. Yeah, I know that's we're going to quite a bit. We have got our family team is going to stay this week, so, which is awesome. We have girls staying to Ross Oh, that's over by, Alexander College, and it's kind of in that, by the, class.
That's far.
That's, yes, and we're like, we used to have to Ottawa quite a bit,
Yeah.
so it's like, not that this time it's rough Island, so, like the 2 or so, more than 2 hour drive. Guys, our boys have conference tomorrow. But they have a conference tomorrow, girls, girls can table, conference, so there's kind of 20 speakers.
After spring schedule, like all the.
Very interesting. Yes, it's been all over. You know, up and down with everything. It's all the translations are very tough because they kind of come in. Now it's like better.
Good stuff. Got someone from both?
But the fact is,
Alright, we have about like half an hour more of material to go, and then everybody can talk as much as they want to. Okay, catch up, do whatever you want to. So hopefully this is a little bit more, or at least new information for a lot of people. So this is our update for our master's program and what we're doing. And I was going to send all of this to you during preseason, and I didn't do it because I find it very entertaining. Okay. So, master's degree. So Katie has come out with their new set of 2020 standards. All of us have to be compliant by to these standards by 2020, which is essentially when we're starting our master's program, so it works out very, very well for us. So there's a couple new things that we are adding into it, okay? So standard 8, there has to be some sort of interprofessional education mixed into it. We are actually sitting pretty okay on that. We have physicians that are teaching some of our courses. We have paramedics that are teaching some of our courses. We are actually planning on integrating a little bit more learning opportunities with our nursing program. We have our nursing sim lab upstairs, so we're trying to weave more of that in so we have that interprofessional basis. Once we get a few more things up and running, we can do huge mock scenarios if we want to, so we can get paramedic students, we can get nursing students and run a scenario from the field up to the ER upstairs for our nursing sim lab. We have the potential to be able to do a lot of that. So the interprofessional education and what they need to do in order to learn and work with other healthcare professionals is going to be amped up. The next thing is that everything that we are doing now has to be delivered at the graduate level. And whatever we consider the graduate level is, that's what we have to go with. So there's no set terms of, this is what makes something a graduate level course. Usually it is in terms of incorporating more current research into whatever they're doing. That's usually how most people are interpreting this standard. So a lot of the requirements in terms of the assignments they're going to have to do for clinical rotations, the assignments they're going to have to do for their classes, all of that is going to have a lot more research components to it, and we're looking at current research. So for our clinical instructors, really what this means is there's going to be a lot of students that are coming to you asking you questions about current research that you may have no idea about. So be prepared for that. Make sure you're keeping current as well. Okay. Another thing that has changed is clinical experiences are supervised by a preceptor who is an athletic trainer or a physician. Previously, it could have been a PT, it could have been an NP, PA, any healthcare professional, basically with a more advanced degree that has been practicing, was able to supervise. Now we are limiting to the clinical experiences to athletic trainer or physician. Not really sure why they decided to do this. I think there was a couple situations where they were having a lot of schools that were having their students work on rotations with PTs, paramedics, whatever it might be. We can no longer count those as clinical hours if it's not an athletic trainer or a physician. Okay. And then all active sites, the one thing that is not changing is evaluated by the program on an annual basis. We are well within those bounds. It will be something that we will continue. I will probably be coming out and doing a site visit and evaluating a clinical site basically yearly. So there is a little shift in terms of the clinical population change. They are really trying to push the students into alternate areas outside of just athletic populations. So the socioeconomic status is a new one. Throughout the lifespan, the pediatric, elderly, all of those things is another thing that they're trying to increase the abilities of. In varying levels of activity and athletic ability, all of those different things. And then the non-sport activities is really what most people are getting are getting hit on in terms of their accreditations, or will be getting hit on in terms of their accreditations. So when we're going through this master's program in this substantive change in order to go to the master's program, we have to show that we can give our students more opportunities in a few alternate areas. So industrial setting, military, performing arts, all of these different situations, we now have to have our students have exposure to. So the clinical plan for our students in our master's program might look a little bit differently just because we have to add in a lot of these different experiences. So if any of you know of situations or know athletic trainers in situations that is this non-sport activity situation, we're going to need a lot of places in the future, so please send their information my way. So preceptor requirements for the 2020 standards. Not a whole lot has changed except for this idea of they have to have contemporary expertise. Now what does contemporary expertise mean? This is apparently what contemporary expertise is. Knowledge and training of current concepts and best practices in routine areas of athletic training, which can include prevention and wellness, urgent and emergent care, primary care, orthopedics, rehabilitation, behavioral health, pediatrics, and performance enhancement. Contemporary expertise is achieved through mechanisms such as advanced education, clinical practice experiences, clinical research, other forms of scholarship, and continuing education. It may include specialization in one or more identified areas of athletic training practice. An individual's role within the athletic training program should be directly related to a person's contemporary expertise. Our national accrediting body and the NATA, the BOC, this whole group that makes up our strategic alliance, is trying to shift to this idea that every practitioner, every professional, anybody who works with our students and is affiliated with a program has an area that they consider their niche. Okay? So if you have done so much research and you've done continuing education and you know you're really, 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 really good at shoulders, that's one of the areas that's going to be your niche. Okay? They're asking people, they're probably going to start asking people to identify what that is. And this goes along with the faculty as well. There's certain faculty that we're supposed to pick the areas in which we are best suited to instruct and get the best possible people in place to instruct in the areas that we are not best suited to instruct. I have a feeling that a lot more about this will be coming in the future, so if you haven't started thinking about what your area of expertise is, this might be a time to start thinking about that before you're forced to choose. Okay? It's a really big push right now for what's coming in the future. So things to pay attention to for that. So our Masters of Athletic Training program, this is where it's going to get interesting and fun. So if you have questions, please just feel free to ask them as we go along, okay? So we have changed our admission requirements. They now go along and coincide with the admission requirements for the graduate programs at Aurora. So we now have to have a 3.0 at the part of the application point, or if you have students that are going through the additional, just the +2 program, they already have a degree, on all prerequisite coursework on their undergraduate GPA has to be at least a 3.0. Okay, so this goes for both the 3.2 and just the +2. Okay, anybody who's applying to the program has to have this. Prerequisite coursework, this is what is required. That is another thing that has changed for for Katie. They are now requiring that students have prerequisite coursework in all of these things in order to go into a master's program in athletic training. Why they have to have all of these different things, some of them I'm not quite sure, but I don't make those decisions. I'm not paid to make those decisions, unfortunately. Okay.